Joe.
Hey, Joe.
Hey.
He's a human resource for a lot of facts that you need and don't need. So if you want to know something about a plan in Wyoming, he's got the answers for you, right? So he's done a good job. He's really our product development and product analyst. So he has a lot more answers than I do. So new to the event is Allison George in the back. She's kind of new to the team. It's only been maybe about a year and a half. And she's the junior member of custom because Mary's been with us for 25 years. We think that's super important. We've been looking at products that marry up really well with ACA. Okay, and then we're going to have a brief discussion on that. We're not going to be training on those types of indemnity products today, but we are hosting a few workshops and trainings that I would encourage you to attend. Okay.
The consumer rep, legal rep from Amerihealth, and actually do a small group that gets funding from Amerihealth as well. Thanks Sal, Joe, and Joe, custom benefits to allow us to present the name. So I'm just going to give you just a little of Amerihealth. And then just kind of, just go step by step through our network, our plans, and try to keep it really simple. If any of you have any questions, I'll be hanging around at the end. You can contact me for help. I'll put it in the whole feed. So we're going to get started. Okay, Amerihealth, we're in Cranberry, New Jersey. Where's Cranberry? Cranberry is sort of like central East New Jersey. We have about 155 employees. Now here's that we have 200,000 members and 3,500 businesses. Now, the second network that we're talking about is the local value network. And really, this is the network you want to focus on for your consumer/individual business. This is the network you want to sell. And this is a New Jersey-only network for the most part. Okay? It covers every county in New Jersey, with the exception of Pennie County. We have 14,000 primary care physicians. They pay less money out of pocket. Because if you go to a hospital, you're going to pay a little bit more money out of pocket. The nice thing about the plans, there's only one deductible and one outside of pocket. And another thing too, a lot of the hospitals and the hospital advantage plans in New Jersey are tier 1 hospitals. You don't live in these counties. Make sense?
Much changes at all. And just based off the membership we have there, market priorities, you can go to the next slide, okay, or I can. You know that I manage other states too. So just where Pennsylvania has fallen on the list based off how bad we're going to be for 24, that's why I'm not allowed to be there today in person. But with that said, we still want to present, we still want you to know what's going on with us. And happy to be here to at least speak to Cigna. And just touching on what we'll cover, right? And she is doing her year-long rotation with me and my team. And I'm mentoring her, coaching her, and she's learned a lot the last couple months. And I know you guys are a really welcoming group. You'll take it easy on her. So I thought this would be a great audience for Taylor to take the ball and actually do the presentation. I will be chiming in, answering questions if you guys have them, but with that said, I'm going to turn it over to Taylor to get the show on the road.
Well, thank you, Natalie, for the wonderful introduction. I guess it's nice to virtually see everyone and meet y'all, but I will just jump into the content for today. Talk the talk on this one. So I'll speak to a couple of examples. Like first, back in 2020 when COVID was really starting to come about, Cigna was the first insurance company to cover COVID tests. Back in 2018, we acquired Express Scripts, which is now part of our Evernorth Health Services. Statewide, essentially looks the same. We didn't go into any new states going into OEP this year. However, we did expand in Charlotte this year, which we're excited. Counties being Bucks,
Chester, Delaware, Montgomery, and Philadelphia. And of course, all of these customers can be enrolled on Pennie, which is the state-based exchange. So no new ads there. And also a good job of also kind of helping set us up for success within the ACA marketplace as well.
Some of the things Ambetter takes pride in are their strong partnerships with our broker agencies, with our agents as well. That's why we offer competitive commissions. We have a dedicated broker support team to assist you whenever issues arise. And then also a top level broker portal to allow you to navigate your enrollments on your own time. So what's new for 2024? I would say the biggest change for us would be our competitiveness. I'll follow that up with the Franklin Silver Plan. The Franklin Silver Plan is going to be, it was a design plan to compete with obviously the leading enrollment of silver plans, which would be the IBX plan on the Pennie exchange. So you're going to see comparable benefits and price points and co-pays to the Independence Blue Cross proactive silver plans. So when you see Franklin Silver, you can think in your mind it's also going to be very similar to the IBX proactive silver plans. Another change in 2024 is the off-exchange plans. Optional adult vision and dental coverage by plans are no longer available. So they're either going to be on the plan or they're going to be unable to add them as an add-on. Their costs for visits, PCP visits, generic and preferred drugs, urgent cares, side by side, so you can actually download it from your broker portal. Use it as a cheat sheet. Is what I tell my agencies and agents. That way you have a side-by-side comparison of all the plans in the coverage map for 2024. Similar plan offerings as we do not have the bronze there on this sheet. The new plan for 2024 in Jersey would be the silver 1010 and with the Atlantic Health System. They should be able to see membership because last year they were turning people away. But as again, we've corrected that issue. However, if you do still have that issue, please reach out to Anthony with the provider information so that we can get that out to our provider relations team so they can re-educate them. We entered the entire state. Obviously, it's only 3 counties, but some of the partner highlights are St. Francis Hospital, Bay Health, BB Healthcare, and Christiana Care. These are going to be the plans for Delaware. Obviously, I'm going to highlight the standard expanded bronze and the clear silver. For those who
Starting to become a right place to do business again. So while we're not in PA today, we're in New Jersey, Delaware. But I thought it'd be a good idea to start building the relationship over again, right? Because certainly want to be in a better place. So, we would love to welcome up for any national footprint like that. Does anything wrong with Ambetter or any of the other carriers? Like you guys can have, United Healthcare, Aetna, and IBC in the back pocket, Jefferson here locally. I think that really rounds out your choices. It's coming.
Hello everyone, I'm Olivia Lazarus, if everyone can hear me in the back. Okay, I am an Aetna broker manager for IoT. So we're happy to be here to talk about the market for 2024. So some of the things we've been talking about, the footprint and expansion in 2024, the network, the member services, I will give a planned overview briefly, and some of the services and enhancements that we had for 2024. So we're very excited. We grew to over 1 million members. And we've been in business for over 170 years, so we're very proud of that. Some of the new updates that we have for 2024, one of the biggest updates we have is the IFQ Marketing Studio, where I'll talk about a little further along, but this will give you the opportunity to order marketing material, promotional giveaways, flyers, things of that sort. We've also streamlined our onboarding process to make it simpler for you to get appointed to sell.
You guys get to ask some questions. Time that we actually got a chance to have here. I'm learning quite a bit from the chance I get. So I would just say to have lunch and say hello to our friends at Pennie.
Thank you, everyone, for the privilege of your time this afternoon. My name is Scott Yeager. Some of you may know me from working with me throughout the years at Pennie. I say that like Pennie's been around a long time. Of course, we're going into our fourth open enrollment. And thank you all so much for everything that you do. You'll see that our new tagline here at Pennie is "Your worth protecting." You're going to see a few slides here that emphasize why, heading into plan year 2024, we want to make sure that as many people are protected as possible. We know our fastest path for making that happen is supporting brokers like yourself. Because the work you do matters. Being able to position someone, an individual, a family, so that they comprehend the value of comprehensive health insurance, why it's important, being able.
And I'm the Chief Diversity, Equity, and Inclusion Officer here at Pennie. And it's my honor and privilege to speak with you guys today. You guys are actually the first group that I get to speak with. So I would ask you to be indulgent. So, and nice and kind. So, the project that Scott mentioned, the brokers and diversification initiative that I was Pennie actually stemmed from me being patient and
Okay, please make sure you get your broker training taken. We're encouraging by October 31st, Halloween, okay? If you can, then at a bare bones.
To the right, we have Chris Staples, he's my leader, he's regional VP, and we have Wayne Wayne, our executive director. So, just a little bit about me before we get started. I've been with United Healthcare for the past 5+ years now. Had the opportunity to lead our Medicare side of the business for Eastern PA and Delaware a few years back. Had the chance to open up the ACA market in Maryland, Virginia, as well as Ohio, and now I get to go back to New Jersey, where I am originally from. But I've been in PA now for over 20 years, so it's almost hard to say I'm originally from New Jersey. But here we are. So that's just a little bit about me. I think that what I'm going to share today is going to be a little bit eye-opening as far as what we're bringing to the table in New Jersey. So, what we're going to speak to, what I'm going to speak to today is going to be more about the market overview, network strategy that we have in place, product, our national marketing campaigns, and lastly, our operational enhancements. So before I jump into all of those things, I think it's important that you hear our story, because just as I'm going to point you out, I don't know your name, but as you pointed out, Terry? Oh, that's right, Terry. Yes. I checked, all right. Merlin, I'm sorry. I got her name mixed up. So anyway, United Healthcare, we were in the ACA space going back almost 10 years ago. We were there. And unfortunately, like many other carriers, national carriers, there was an exit. It was a very unpopular decision that was made. It impacted many. Not, of course, just all of you, our distribution partners, but of course, it really impacted members. This was a new law. Nobody knew where the direction was headed. And so these decisions were made that were very unpopular. However, CMS has a rule that when you leave the ACA market as a carrier, there is a hiatus of, I believe it's about 6 years that you must take before you're able to get back in. 6 or 7. Now, during that time frame, we had the opportunity to learn the market, to learn the ACA market. We saw it stabilize. We've seen it become more profitable. We've actually seen what was needed in order to restart, to be
sales channel at Highmark. With me today, we also have our director of market strategy, Mike Colino, and Jake Connors. He is our broker manager for the SEPA region. Just want to say thank you to CDP for having us here today. We're extremely happy to be here. Anytime we get a chance to present our plans and present our product portfolio, especially in a new market, a new region, we're taking advantage of it. We're very excited to do that. Personally, I'm very excited right now to be standing on 2 feet because I just drove 5.5 hours from Pittsburgh. And my legs are cramping up a little bit, so I'm pretty happy about that as well. So, but again, thank you to the CVP team. Before we get started here, before I pass it off to Mike Polino to review our product strategy and our product portfolio for the upcoming year, just want to go over a few housekeeping items. The materials that were passed out just prior by Jake, that is our plan comparison guide, what you see in front of you right there. If you open it up, you can see it has our bronze plans, our silver plans, our gold plans, etc. We're very excited about our plans, and we think we can be very competitive in the SEPA region for this upcoming year. After the presentation concludes, I am also going to bring in a few boxes of these guides. We call these our agent field guides. It's pretty thick, pretty comprehensive. These detail everything about Highmark and our product portfolio. Doesn't matter what line of business you're looking at. Within this,
it's not in the trifold, but there is an off-exchange only silver plan.
Which one is that?
It's this one right here. Not in the trifold, will be in the agent field guide. All these plans are available on and off, or all these plans are available off exchange. This one is the only one that is off exchange only. All these other ones are going to be available on exchange on that. So that's the off exchange only silver, and then our 4 gold plans are our most popular options, all available on and off exchange. These are gold 1500 is our new. Platinum is also available in Delaware. That's there. Just the same view kind of turned on its side. Calling up here for adult dental and vision. We have at least 1 option at all the metal levels with 2 options at gold. Also for silver, you'll see our 2 silver options, the 7,000 and 2,900 are just the base plans. The little numbers on the bottom here that are admittedly tough to see are the deductibles for the 87 and 90.
What you need, the date of the consent was given, the name of the consumer, the name of the agent, how much consent to aid form will be distributed before ONJ, so that'll be coming out soon. Regarding ACA material, like the trifold that you have today, you're going to order that through our producer portal, which is called Marcom. Once you get into the producer portal, then you're able to navigate to Marcom.
And Southeast PA rating area 3 counties. We're mirroring the Jefferson facility footprint. That's where our competitive advantage lays. So we're in Philadelphia, Montgomery, and Bucks counties in 2023. In the future, we'll be expanding, but this is the start of something big for us. We want to go really well in Europe. So that's going to be a theme today. Jefferson Health Plan. What's our advantage? Why are we doing this? So you've seen the success of others like UPMC. And you just get these competitive advantages when you have access to patients through a trusted resource, your doctor, sharing information about health value plans. But when you're thinking about plans, these are the 7 you want. Again, we have no medical deductible plans on all tiers, and all of these plans have these great options. The thing I'll close with on this slide is we're trying to differentiate besides just being the lowest price plan. We want to have attractive options for the brokers too. So with that, I'm not sure if we're the only plan doing this, but we're offering compensation for completion of health assessments, health risk assessments, HRAs. If you sell Medicare, you're probably familiar with those. They're not as prevalent in ACA. We're a brand new plan, and we need to get to know our members. We need to know which ones benefit from care management or disease management, which ones we want to reach out to and bring in to see their PCPs early in the year. So we're willing to pay you all to get them new member status.
Right, so hopefully everything in the office is like you came to us with CVP, and it is different market. Really with we have new carriers that want to come in. We've seen this in the past, right? The carriers have come in, oftentimes priced at a spot that's not sustainable, and we've seen the impacts of that after not that long, right? Where they leave the market, and you guys are pricing blue anyway.
And then, I don't mean to just sling mud for no reason, but I think what Sal mentioned, he really believed it. Company, our company, obviously, we've been around for 85 years. Right. During the commercial real estate crash of COVID, we bought our building. That's our commitment to you. I don't know what else to tell you. So we're deeply invested here, but not just financially, also personally. Right?
We want the best that we have to offer, right? We want the creme de la creme. Here it is, there's $0 deductible, out of pocket $8,000. Specialist gift is going to be $15. Some of the products that we offer, again, it makes it very convenient for your members. Again, viewing your ID card, your ID card, viewing things. You name it, all the common things, and it's very, very convenient. We've been ahead of this, we've been doing this. And just again, it just gives us, to the members, just so it's easier, as far as tools that you guys use, tools that's available to members,